I'm glad you're joining me for another lesson on growth and development. In this lesson, we're going to talk about what to expect for our toddlers. So let's get started. Our toddler patients are ages 1 through 3 years. And pretty much what's happening during this phase is kind of a refining of some of those really basic skills that they started to develop in infancy. In the next phase, preschool, you start to see them really perfect some of them. But for toddlers, there's still a lot of struggle. And this is part of the reason that we get that lovely phrase called the terrible twos. They want to do everything on their own, but they really can't. So there's just a lot of opportunity for injury and also a lot of opportunity for frustration. Okay, so let's get started looking at our toddler milestones, and we'll begin by looking at their growth. So growth slows a lot compared to what was happening during infancy. And because of this, their caloric needs are also a lot less. And this is a huge relief for parents who are struggling with their toddlers who are probably picky eaters. On average, they're going to be gaining 4 to 6 pounds a year, and they may grow up to 3 inches a year. And you'll notice when you look at a toddler, their heads are still pretty big compared to their body size, which does contribute to the fact that they are still pretty injury prone. So toddler motor skills really come on quite a bit. But again, a lot of it is still very clumsy. They learn to run, but they can't quite stop very easily. They can go upstairs, but they can't do it like an adult. They still do it with sort of 2 feet at a time. Their fine motor skills progress from sort of stacking blocks all the way to copying a circle. And by 3 years, that 18-month-old that couldn't run and stop at the same time has learned to ride a tricycle. So it's quite a big jump from a 1-year-old all the way up to a 3-year-old. There's a lot that happens during those years. Language development is probably one of the most exciting things that's happening for toddlers. Their comprehension just explodes, and they really begin to be able to express themselves and tell little stories and also ask for things that they need. For milestones, you're looking for them to be able to know and use 300 words by the age of 2. And then also another really big one is that they're linking words into really small sentences, so putting 2 words together by the age of 2. From a nursing point of view, definitely keep in mind that our toddlers can understand so much more than they let on. Even if they aren't able to speak very much, they can understand what you're saying. So it's important to be pretty careful about what you say in front of the child. So sometimes this means we have to take a parent outside of the patient room to explain a procedure or talk about what's going to be happening, just to protect those little ears from hearing some words that might be scary for them. Toddlers are very determined to do things on their own. Erickson describes this as being the autonomy versus shame and doubt phase. And basically what needs to happen is they need to be able to try things on their own and then be helped and encouraged to succeed. It's this drive for autonomy that gives us that phase of the terrible twos that we talked about. So things like eating, dressing, and toilet training are the 3 most obvious tasks that they want to accomplish. And these can become battle zones for parents. And we'll talk a little bit about how that plays into our patient education in just a second. So our toddlers are very playful, but what they tend to do is engage in parallel play. And what this means is that they're playing alongside other kids, but they're not really cooperating or interacting. They love symbolic play, where they're mimicking everyday actions. So they may walk around and pretend like they're talking on the phone, or they're cooking and serving dinner. My biggest piece of advice for toddlers is to avoid giving them the opportunity to say no. We all know that this is a toddler's favorite word. And if you walk into their room and say, "Can I take your temperature?" they are 100% going to look at you and say no. And then you're stuck. So instead, try, "Hey, I need to see how warm you are. And I also need to put this little red light on your finger. Which one should I do first?" And that gives them the opportunity to have a little bit of control and be involved. They may still run away and yell no, but at least you tried. Right, so I mentioned just a second ago that parent frustrations can be a little bit high during this age group. And it's because of this, there are a lot of opportunities to provide education about parenting. And honestly, this can feel super awkward. Like, who wants to give someone advice about parenting? There are a million ways to do it. So how can we as nurses possibly do that? Well, there are some really basic tips that are always a safe bet to recommend, and they're all about positive parenting and boundary setting and minimizing opportunities for misbehavior. I've simplified some of these basic things, and they're outlined in the patient education section of this lesson, so definitely take a look at those. Other topics that nurses may be asked to provide information about are toilet training, and then sort of picky eating. So these are common education things that parents want to know more about, and you'll find more detailed information about these in the outline also. But a couple of things I want to highlight very quickly. For toilet training, during the toddler years, we only expect children to be dry by day. Nighttime dryness may not occur until they're 5 years or even a little bit older. For nutrition during toddler years, it's not uncommon for toddlers to have diets that are actually pretty poor in nutrients. Vitamins can help with that, but one thing that's really common is an iron deficiency, and this results in sort of tired, pale, anemic toddlers who actually may need an iron supplement. Again, check out the outline and notes for more on all of this. Your priority nursing concepts for this content on our toddler patients are human development, patient-centered care, and health promotion. Okay, guys, that's it for our very busy and feisty toddler patient group. They are at a slightly lower risk than our infants because growth has slowed down and they are less independent, but there is still a lot going on. So just remember these 3 major points to take away from this lesson. Number 1, toddlers want autonomy. Okay, and this translates into self-care, nutrition, and toileting. They want to do it all. And most of your education topics stem from this. Number 2, language development is the most exciting and rapid thing that's going on for our toddlers. Number 3, safety is still a major concern. So make sure that you can educate parents on preventing falls and preventing drowning, how to keep their house safe so that we don't have poisoning problems, and that they don't get burns. Those are the big topics there. All right, that's it for our lesson on growth and development during the toddler years. Make sure you do go and check out all the resources that we have attached to this lesson. Now go out and be your best self today, and happy nursing.